Hello everyone, today we are going to talk about contraindications to PMU procedure. Well, number one, what you need to do, that you need to make sure to have every client fill out a consent form where the client has to read and acknowledge all contraindications and read before and after instructions before you start the procedure. You need to make sure that you always keep one copy for yourself and send one copy to your client. And it is always best to go over all the things before your procedure during a consultation appointment so that if there is any problems that will come up, you can plan for the future. Always ask every client about their allergies. If in doubt, you need to perform a skin patch that is normally done on the wrist or behind the ear area, and you need to use the pigments and anesthetics that will be used during the actual procedure. And you need to wait for about 3 weeks before scheduling the appointment. When you are creating your consent forms, you need to consult with local regulating authorities about additional information that you need to keep on file for each client. Some states will require an ID number or other pieces of information, so you need to consult with local regulators to see what else you need. Also, you would need to consult with your attorney about putting together a consent form that will best protect you. And also you need to note that permanent makeup professionals are not allowed to treat or recommend treatments for infections, diseases, or any abnormal conditions. Such clients must be referred to physicians. So here I'm going to go over contraindications to permanent makeup procedure. Number one, it is pregnancy or nursing. Of course, you don't want to take any responsibilities for pregnant ladies. Number two is cancer and chemotherapy. The procedure must be performed at least 6 months after the last treatment and with a note from a doctor to make sure that it's okay to do the procedure. Number three is current infections and fever. Number four is diabetes. Diabetes is actually the form that where the client has to take insulin. And the procedure can be allowed with a note from a doctor. But you have to remember that the clients that have diabetes are different in a way that it might take a much longer time for them to heal. Number five, any disease that prevent blood clotting. Number six, any type of uncertain skin formation or skin growth, moles in the area of future permanent makeup. And you remember that if a client has just a regular mole in the area of the procedure, you always will go and work around it. Number seven, any type of skin disease or infection in the area of a future permanent makeup procedure. Number eight, allergies to ingredients in the pigment or in anesthetic. And as I already said, that if you or your clients have doubts about this, you should perform a spot test 3 weeks before scheduling the procedure. Number nine is high blood pressure. And it is recommended if a client has a problem with high blood pressure, they should take the medication before the procedure. Number 10 is epilepsy. Number 11, severe psychological disorders. Next, number 12 is hepatitis C and HIV. And note that always work with all of your clients that as there may be potential carriers of those diseases, because you never know who may be infected and you can spread the infections to other clients or to yourself if you're not careful. Remember that your client's health is in your hands. Number 13, if the client is under alcohol or drug influence, you should let all your clients know that they should not take any alcohol within 24 hours before the procedure, because alcohol acts as a blood thinner, and it will be difficult for you to work with those type of clients. Next is Botox injections of less than 3 weeks before the procedure. And the reason why we say that is because it takes time for the Botox to take effect, and simply if you do the procedure earlier, what can happen is your work may look asymmetric. The next is keloid scars. And keloid scars, those are hypertrophic raised scars. And I've had instances where clients had keloid scars and at the same time they had tattoos on their body. But what can happen is still, this is a 50-50 situation. You may do the procedure and the client may have keloids. So you have to be really careful with that. Number 16, Accutane treatments within the past 12 months. 17, recent chemical peels while the skin is still peeling or flaking. Not only chemical peels, any type of laser procedures, any type of invasive beauty procedures, you need to make sure that the client's skin healed before they come for treatment. Next, recent use of Retin-A causing skin to peel or flake. You have to let your client know that they should stop using Retin-A at least a week before the procedure. And also the use of blood thinners such as baby aspirin can cause bleeding and poor results. If your client's physician allows, your client should stop taking aspirin 1 week before the procedure. And they can resume right after the procedure, taking all the medications. Also, the use of alcohol within 24 hours before the procedure can also have the similar blood thinning effect. If the client has HSV-1, which is commonly called cold sores, they should be taking medications such as Valtrex or the prescription medications that are prescribed by their physician before starting the procedure. It is better to avoid permanent makeup procedures during the menstrual cycle because of the painful sensations during the cycle, and that can interfere with the procedure. As I said earlier, make sure to have every client fill out a consent form where the client has to read and acknowledge all of the contraindications and read before and after care instructions. And I will leave you an example of health-related questionnaire and the client consent form below this video. It is convenient also to have an online waiver program such as Smart Waiver, or there's many other brand apps that will store your client's consent forms for you at a small fee. The benefit of using those online programs is that you can take before and after pictures, you can have all the client information, you can have a consent form in one place, and you don't have to save all the papers and store all the papers. And also it's beneficial to have everything on your iPad. So you have your consent form, all the pictures, all the information in one place on the iPad. You also need to talk about before and after care instructions with your client and warn your client about what they should expect after the procedure. Overemphasize the negative side effects that will happen after the procedure. You need to walk them through every step, what's going to happen after they walk out of your studio. For example, you can say that what's going to happen is, for example, we're doing the eyebrows procedure. So you can say your eyebrows are going to look dark when you come home after the procedure, and they will intensify in darkness the following week until they start flaking and scabbing. And after the flakes and scabs come off, usually you don't see any color. The eyebrows literally disappear. And it takes another week or two to see the actual results. You have to walk your clients step by step so that it will protect you from having clients texting you, calling you and say, hey, what happened? Where's my eyebrows? Something is going on. So you always have to overemphasize the negative side effects so that clients don't bother you. And now I'm going to tell you the instructions that I usually gave to my clients, the before care instructions. I always told them not to tan 2 weeks before the procedure. Don't do Botox injections at least 3 weeks before the procedure. Stop using a retin A 1 week before the procedure. Don't do any chemical peels or any lasers 1 week or more before the procedure. And also use a gentle scrub in the area of permanent makeup procedure the night before the treatment. And after care instructions, after you finish the procedure, tell your clients to wash the area of the permanent makeup with liquid soap and water 3 to 4 hours after the procedure. And after that, keep that area dry until the scabs come off or the area stops flaking. If you're doing the lips, then that's a little bit different. Lips have to stay moist, and I normally recommend it to use a Vaseline. Also, I recommend it to have clients drinking with a straw for the time being while the healing process is going on. Also, you should tell your clients that they should not pick on the scabs and wait 4 weeks before tanning, going to the beach, going for vacation. And if they're experiencing any signs of allergic reaction, they should contact their physician immediately. Thank you so much for watching, and I will see you in our next lesson.